Hi, I am Alexandra, or Allie Schaber. I'm the neurosurgical oncology nurse practitioner, or tumor NP for short, with UofL Health. I always kind of had a passion for medicine, hospitals, doctor's appointments. I was kind of the weird child that enjoyed those things. And I initially thought I wanted to be a dentist. So I majored in biology and chemistry with plans for dental school. Had an internship the summer before my senior year and realized it was not the right fit for me. And then just started kind of shadowing within the hospital, realizing I wanted kind of a more acute thing, if you will, and found some nurses and realized how much potential there is in nursing, so many different things you can do with it. So switched career paths and then got a second bachelor's as a nurse, worked in the neuro-ICU for 2 years and then went back and got my master's as a nurse practitioner. So I am the neurosurgical oncology NP, which I'm the tumor NP, but the surgical side. So not, from the cancer side as far as prescribing the chemo and things like that, but from the surgery side, so both benign and malignant tumors. I think anytime you're working with cancer patients, whether it's on the surgical side or on the oncology side, I think it's definitely a calling. It's emotional, it's hard, but one of the things I love are the relationships I build with patients and their families. If it's ever not somewhat emotionally hard for me, I'll realize it's not for me anymore. I think our multidisciplinary cancer clinic is hard to compete with anywhere. It's neurosurgery, which I think is a rarity. A lot of times neurosurgery operates and then fades into the background, but we continue to follow our patients, continue that relationship. And I kind of work as a liaison between the surgical side, radiation oncology, neuro-oncology, as well as we have cancer rehab specialists, which is unique to the area. Not many people have dedicated cancer rehab specialists. I started a primary brain tumor support group. So it's off campus, it's not me as a provider, it's me running it as somebody just socially getting to know patients, but mainly to connect them as well as their loved ones to other people, to meet people that are a little further in their journey that they can connect with, to know what to expect with radiation, what to expect with chemotherapy and things like that. And that's something that unique that we provide that other centers don't. I do. I think that learning to connect to a patient on a real level and not always just in a provider conversation scenario is so important. And I think that that's something I think through nursing and being at the bedside for a while and then being on the inpatient side, I love to connect to patients. Even with family members after patients have died of cancer, I continue those relationships. And I think that that's a huge part of patient care. Well, I'm from Texas originally, went to school in Missouri and then ended up in Louisville, met my husband who's from the area. We have an 18-month-old little boy and a 3.5-year-old little girl. So it's busy, but hobbies-wise, I enjoy running. I love being outside. Our kids love being outside too. So anything outside and traveling when the world permits it.